Hello, I'm Marie McCabe, CEO of Alzheimer's Australia Vic. This DVD is about one of the more prevalent types of dementia called Lewy Body disease. Lewy Body disease is a degenerative brain disease. It causes gradual brain damage, resulting in changes in movement, thinking abilities, and behaviour. Unfortunately, there is no cure. Lewy Body disease includes 3 overlapping disorders. The best known of these is Parkinson's disease. Parkinson's disease affects the control of body movements. As Parkinson's disease progresses, many people also experience deterioration in their cognitive or thinking abilities and may develop Parkinson's disease dementia, which is another of the disorders within the spectrum of Lewy Body disease. The third and least well known of the disorders within the spectrum of Lewy Body disease is called dementia with Lewy bodies. In this condition, it is the person's cognitive abilities that are most affected rather than their movement. Dementia in Lewy Body disease can be very different to the normal perception of dementia. Alzheimer's disease is the most common form of dementia and is characterised by memory loss. With Lewy Body disease, however, memory can remain intact, but there's a loss of other cognitive abilities such as attention and spatial skills. This DVD was made with the assistance of Dr. Catherine Nicholson. Catherine has worked closely with people with Lewy Body disease and their family carers to learn more about how this condition impacts on their lives and to educate those of us who provide support to people living with Lewy Body disease. Catherine is the interviewer in this DVD. We would also like to sincerely thank Robin and Liz Grove, who gave so generously of their time and shared their story.
Robin, thank you so much for inviting me into your home and allowing me to chat to you about all of these things that have been happening.
I'm hoping it's going to be a pleasure.
Oh, so do I. Tell me, what did you first notice?
The first thing that really gave me an indication something was going wrong or had gone wrong was that I was playing the piano, accompanying a singer whom I knew very well, but just as the concert, which was a money raiser, was about to begin, I looked up at the music on the stand in front of me and suddenly realised that I couldn't understand what the symbols meant, the musical lines on the page. I simply couldn't read it. And I said to Helen, the singer, I said, I must have the wrong glasses. I'll go dash home and get my other glasses. And she said, no, it's not your glasses. The glasses are fine. She said, there's something else wrong. I don't know what it is. That was very strange. Of course, I've played music since I was just over 5 years old.
Mm. Previously, I'd thought his playing was really very inconsistent and not very good, and he'd been an excellent pianist. And he'd been reluctant about the concert, said, oh, it's not really music that I want to play.
So he was aware of a change, you think?
Well, no, I don't think he was aware of a change. I think he was rationalising. And I think it's very common for people to rationalise about various sorts of deficits when you don't know what is going on. Of course you want to understand what's going on.
So did you have any medical investigation after that happened?
I did. I made an appointment the next day with a neurologist. The first diagnosis was possibly I'd had a minor stroke. But this very soon turned out not to be a stroke. It started off in one hemisphere of the brain, and then the next thing I knew, after it had been investigated for a little bit, it turned around and popped up in the other hemisphere.
He had quite marked left side deficit, and in fact the previous year he'd had his first ever car accident in which he was responsible, when he failed to see somebody coming on his left. And we didn't connect that with what happened subsequently, but it made sense in retrospect.
In retrospect.
So it was clear that he had some form of dementia by about 2007. It wasn't until 2008 that the Lewy Body diagnosis was confirmed.
And did you have a number of diagnoses given to you along the 3 or 4 years that you were being investigated?
Yes, people were very hesitant to say it is this or it is that. But the general impression I got was that this was a condition about which not a lot seemed to be known.
I think we're still finding out every day something new.
Yes, how depressing.
When I began to inform myself about the condition, I thought if I'd just seen that list of symptoms, I could have said, well, of course that's what he's got. You know, in particular, the acute sleep disorder, the writhing and thrashing around, the shouting, you know, whacking me on the head by accident and so on.
You were hit several times, were you?
I was hit a couple of times, and also he threw himself out of bed. And this was all extremely alarming. But he had always been a poor sleeper, you know, very short sleep and nightmares and so on. So possibly, you know, the short REM sleep disorder was already there long ago.
Some of the research suggests that rapid eye movement sleep behaviour disorder, which is its correct title, is present much earlier and an indication of Lewy bodies.
Stand up, sweet.
Early on, he began to walk in a rather bent way and he began to shuffle. And I remember my daughter saying, "Oh, for God's sake, Mum, can't you get him to speed up a bit?" I said, he absolutely can't.
And that's part of the Parkinsonianism.
Yes, and my former brother-in-law, who's a doctor, visited us quite out of the blue and said, "Oh my God, he's got Parkinson's."
So what do you find your greatest challenge is now?
I've lost my sense of purpose and the fulfillment of having a wonderful job. Well, I can't say I've lost that exactly. I resigned. That was the moment at which I thought I have to reconceptualise my life. I can't go on teaching as I have been teaching because I gradually discovered that more and more skills were being taken out of my range, were beyond me anymore.
I discovered myself increasingly taking over tasks that he had performed in the household. I mean, he cleaned and I cooked. I made the mess and he cleaned up after me. And he became increasingly unable to do that. That continues to be painful for him because he sees me rushing about and he says, what can I do? And mostly I have to say, nothing, please sit down, keep quiet, let me get on with it before the guests arrive or whatever.
As these things were peeled off one by one, it was rather eerie. It was like fencing with someone in the dark, because I wouldn't anticipate, usually I wouldn't anticipate, that the next time I went to use some skill, e.g., how do you cut up your food when you're seated at the table and you're going to eat something. Suddenly to discover you don't know any longer is a real shock.
So, do you mind if I just turn your plate? Okay, here we go. Keep your hand out.
Is it a knowing or is it a visual perception that you're not sure where the food is on the plate?
It's a bit of both. I do know that I've got a defective left-hand side when it comes to really noticing things. My attention drifts away from that side. But it's more than that. It's also an inability to remember what things are for. So that, for example, if I've woken during the night and I need to use the lavatory, I usually need somebody to show me where it is and how it works. And that makes life a little bit more complicated.
Disturbing for everybody's sleep,
Disturbing
isn't
for
it?
everybody. But I mean, let's be honest, that's the way it is. And I've lived in this house for, I think we've been here for just on 40 years now. And I still can't be sure that I'll be able to find my way to the bathroom now.
Recently, we've had the difficulty of his, and this is really in the last few weeks, just not being sure what to do. He says, look, I need to empty my bowels, what do I do? And so I have to direct him to the loo and take down his trousers and so on. And it's the same. He'll say, look, I need to pee, what do I do? So he's not in a position of just soiling himself, but wanting and being
assistance.
He is distressed about that I have to tell him and have to manoeuvre him into position and so on. And because of the physical rigidity, it's quite difficult.
Is he getting up often during the night to wee?
No. But that is that's a recent improvement through changed medication. I mean, the medication regime is constantly being adjusted, both for the cognitive deficits and for the Parkinsonism.
I notice you've got stairs. Are they presenting a problem to you?
They are. They're a real difficulty, stairs. Anything with a pattern on it is liable to give you difficulty. And it will resist you and want to take over from you and insert something else of its own, so that hallucinations are one thing that happens in this particular form of dementia.
And when you have hallucinations, are they malignant? Are you frightened of them, or are they benign and of the family and you just recognise that they are an hallucination?
Mostly the latter. And it can be a very simple thing, like seeing somebody wearing a coat with some ornamentation on it, and the ornamentation will then reproduce itself 20 times. And you think, I didn't notice anybody wearing a leopard skin coat when I got into this railway carriage. But this woman is undoubtedly wearing a leopard skin coat.
And the leopard doesn't come to greet you, does it?
Luckily not.
That's good. Do you perceive that you have better days, some days are better than others?
Very much so. I think that has increased over my acquaintance with my opponent.
At least you're fighting, this is good.
Yes, well, so far as I can. I fight back occasionally. I know that for today the opponent has got the upper hand and I can't do much about that. But that's quite rare for me, luckily.
What do you see as your greatest challenge now, Liz?
To prevent him from feeling utterly redundant. I think that even though you wouldn't describe him as depressed, and he never was the sort of person who got tangled up in his own problems because he was so outgoing and so busy. And the lack of meaningful activity is the thing that he finds hardest. So we've had to substitute a range of activities. You know, we have many shared interests, and that's made it easier to go to movies of our mutual choice, to watch opera, to listen to music, to go to concerts. And we're doing more of that than we used to.
And he still obviously enjoys those sort of things.
Oh, he's very engaged by them. The loss of independence, independent activity has been, I think, the greatest problem for both of us, because it means that life is much more circumscribed. And we can't just go off and do our own thing as we always did. And
it's not the retirement you thought you were looking forward to?
Oh, most certainly not.
How do you spend your day?
Well, it's changed over the few years since this began. I read a lot. Alas, I can't play the piano anymore. My hands feel as though they have no idea what a keyboard is for. What is it about? So that I can't use the word processor. It's so difficult to use a keyboard, that it's easier for me to dictate anything I want to write.
Good.
I mean, he does read, but I note when he's reading a book that he does seem to spend a long time on a particular, and he jumps from one book to another. So the attention and concentration are certainly affected. But his perception, in many ways, is not affected.
Do you have to provide him with a lot of physical aid with activities of daily living like dressing and those sort of things?
Oh yes, and that's happened increasingly. I mean, early on he was having trouble getting his trousers the right way round, shoes on the right feet. His jumper would be back to front and so on. And a bit later I became aware that he wasn't showering properly. There was one occasion when before he stopped driving, that he jumped in the car in his pyjamas. Now that was completely bizarre. But bizarre behaviour, it has not really been a feature of his condition.
And you've got some very good support in Liz.
Indeed. Yes, she is absolutely miraculous in what she manages to do in the course of a day. I wouldn't be able to manage at all without her constantly helping. But it's not fair to ask any one person to endlessly be at your side.
So have you investigated any respite or anything like that at this point?
I haven't actively done so, but we have had a visit from the ACAS assessment people who got him to sign a document just in case I need time out, perhaps, if I were in hospital or whatever, and, gave us a list of places. I would prefer to delay that for as long as possible. I realise that he will continue to be aware of what's going on, and I think to be institutionalised would be the least desirable thing for us. So we'll hang on as long as we possibly can. But it's already evident that the rigidity of the limbs, the difficulty dressing and following instructions, if he becomes immobilised, I won't be able to handle him. But he's very cooperative in many respects. I mean, in all respects, really. He's never resisted and is always able to respond positively to, to sensible suggestions.
I'm hoping we'll find ways of making the house itself a bit more user-friendly, and though we both love it the way it is, it could be made easier, I think.
Are you considering doing some bathroom renovations or something like that?
Yeah, we've been talking about them just a couple of days ago. So I feel that there's a bit of purpose to that.
It sounds like your dogs have said, we've had enough.
That would be the kind of thing a dog would say. Yes.
So thank you very much indeed.
Yes, thank you very much.
A pleasure.
The story of Robin in this DVD is just one person's experience. Other people will have a different story because Lewy body disease affects everyone differently. Alzheimer's Australia supports people with all forms of dementia, and as an organisation, we're tackling them all. A series of help sheets on Lewy body disease is available online. You can visit our website at fightdementia.org.au or call our National Dementia Helpline on 1800 100 500. We created this DVD to help you begin to understand what to expect if you're living with Lewy body disease or caring for someone who is, and to know that you are not on your own and that there is support available.
I wonder, from your point of view, having done a lot of research into the condition, whether you find Robin's situation and ours fairly typical, or whether there there is a great deal of individual variation.
Everybody's situation is unique, obviously. It depends on so many variables, but the consistency of story is there. The difficulty in getting a diagnosis was a huge one. The issues about people not understanding that the person is still in today's world, that they don't lose that connection the way people typically with Alzheimer's do, is another big misapprehension of, or misconception of people. I think that the combination of the motor or Parkinsonian problems with the cognitive, and then with the neuropsychiatric issues of the hallucinations and the REM sleep disorder, are huge. But then when you add to that the autonomic problems of toileting, and I don't know if Robin suffers from having problems controlling his own temperature and things like that.
Oh yes, he's very cold. Most
All
of the
these
time
things.
he's very cold, and that's new. Actually, one thing I didn't mention was that he's had a few episodes of well, I think it is a form of unconsciousness where he can be sitting in a chair and just be completely unrousable. And it might be 5, even 10 minutes.
And that's another typical sign of the illness,
But
called a syncope.
he's had it maybe 3 times in over the last 5 years. So it's curious. You think, oh, this is ghastly. It's going to be like this, but it isn't, fortunately.
And that's where it's so variable. I mean, I suppose there are so many different signs and symptoms that you can pick and choose, one from here and one from there, and they do vary. And obviously they vary with the level of pathology and the progression of the illness and those sort of things. So I asked you about swallowing, because that seems to be one of the later problems, later in the disease.
Sure. Actually, fatigue has been quite a problem. He does get very tired, and I need not to stretch him too much. On the other hand, if he doesn't walk enough, if he doesn't get enough exercise, he's likely to become, even more
Rigid.
frail and dilapidated. So we try and keep him moving.
Even though it's your story, it is very typical of the other stories that I've heard. And there is a presentation of this illness that is consistent, and you don't necessarily have to have the fluctuations, or you don't necessarily have to have the Parkinsonianism for it to be classified as dementia with Lewy bodies. But they all tend to be manifest in the disease in the end. And I think, as you said, had you known what was on the list, you would have been able to diagnose it a lot earlier. This is the message that we're trying to get out there.
If we'd known, we probably would have managed life a bit differently. We wouldn't have been hovering, waiting, waiting to be told. And I think that it would be very helpful to people to help plan their lives a bit if they've got more knowledge of what is likely to happen. I think that's why a lot of people are very insistent. They want to know, what is the progression of this condition? Will I get pneumonia? Will that be what carries me off? How long do I have? And there is no such. There's no answer to the question.
It's like how long's a piece of string, always.
Yes,
I mean, with any progressive illness, one never knows. But there's a high probability that an aspiration pneumonia will be part of the latter, late stage disease picture. I think you can probably already see it. Falls are another big issue.
Oh yes, yeah.
And quite often it's the fall that creates, an injury that results in somebody being in bed for a long time. Obviously they're in bed for a long time, their condition deteriorates, and it becomes a little bit of a snowball.
Sure. Robin's in another room at the moment, but usually if we see his neurologist or his neuropsych or his GP or whatever, we are in the room together. And it's a real matter of tact, wondering, how much one can say. And quite often I'll allow him to offer his interpretation of events and offer a bit of correction if it's important. But I often don't say what I might if I were talking to that person alone. And it's a bit of a problem because he's perfectly well aware of what's being said. And I wouldn't want to demoralise him further.
I think it's really important that you make provision to have your say, and even if it means making a separate appointment and just say, or writing a letter before you go, which can sometimes be a little bit awkward and confronting because what you want to say doesn't necessarily come up at the time. Quite a few of my research participants talked about the fact that in a doctor's consulting session, their spouse was really sort of sitting up straight and with it and having the conversation, patient to doctor relationship, and anything that they were saying or their rolled eyes or, you know, shakes of the head in the background were ignored. And they found that very isolating.
Yeah, certainly with the excellent neurologist and neuropsych, who are both friends and colleagues, that situation hasn't arisen. But I've sometimes thought I might present the situation slightly differently if you were not in the room. And I have spoken by phone to each of them and emailed if there's been a problem with medication. So it's probably okay, but I think you never quite know how distressing it may be to the person with Lewy body dementia. And because Alzheimer's patients are so out of it and people must talk about them and across them and so on all the time.
We would like to think that they didn't, obviously, but we know that it does happen.
It does happen.
And, you know, early in the stages of Alzheimer's disease, people can understand and have insight into those situations as well. And that's why we always recommend that you make a separate appointment or, you know, quite often I've seen situations where the consulting doctor will actually ask the person to leave the room and have a chat to each individual independently. And if that's part of their practice and it's not seen as you wanting to talk behind their back, that then is quite reassuring that you can have your own say. But I think that if that's not the norm, then it's perhaps easier to make a separate appointment.
Yes.
And just sort of say, you know, I've come here. And I think it's also important to recognise the fact that you have your own concerns.
I think these days we're just much more open about it.
Yeah. It is confronting.
Oh, of course.